The equipment and implements should be checked for completeness. They should include a pair of non-sterile gloves, a pair of sterile gloves, saline to inflate the bubble of the catheter, lubricant for the tip of the catheter to aid insertion, gauze swabs soaked in disinfectant, a correctly sized flexible Foley's catheter, and a urine bag. Note the tip which will be connected to the catheter later on. Also note the tap which can be used to drain the bag. The hands are disinfected and the non-sterile gloves are worn. The catheter now can be removed from its outer packaging, taking care to keep the internal packaging intact to keep the catheter sterile. The catheter can now be connected to the urine bag and set aside. Using gauze swabs soaked in disinfectant, the labia majora are disinfected in the direction of the anus. In the same manner, the labia minora and lastly the external urethral orifice are disinfected. Expose the external urethral orifice by retracting the labia laterally and cranially using the non-dominant hand. Care must be taken not to contaminate the external urethral orifice to minimize the risk of a urinary tract infection. This risk is minimized by not reusing gauze swabs and by not wiping towards the external urethral orifice. The non-sterile gloves were taken off, hands were disinfected, and new sterile gloves are worn. This is done to minimize the risk of contamination while introducing the catheter into the urethra. The outer package of the catheter is removed and the sterile tip is dipped in lubricant, as seen here. The labia is spread using the non-dominant hand. The catheter should be grasped approximately 2 to 3 centimeters from the catheter tip. This is done to leave room for advancing the catheter. Handling of the catheter becomes more difficult as this distance increases. The lubricated catheter is introduced into the urethra. Care is taken not to touch the labia with the catheter tip in order to minimize the risk of urinary tract infection. A backflow of urine can be seen within the catheter, which confirms correct placement of the catheter. The balloon of the catheter is inflated with the recommended volume of saline. This should only be done if the catheter balloon is advanced far enough inside the bladder. Lastly, the catheter is immobilized using a catheter fixing dressing. Alternatively, a support strap can be used. This is not shown in this film.